All right. It's wonderful to be here today with all of you. I'm so amazed at the turnout. I see people standing in the back. This is really wonderful. And I have to say, when I was first invited to attend this symposium, it was 2020, and that obviously didn't happen that year. So it's amazing to be back. I think we all are relishing the opportunity to see each other face to face after the pandemic, and I'm excited to talk to you about living well with Parkinson's disease. So for those of you looking for your continuing education today, we have learning objectives for the talk. So we're going to review a holistic definition of wellness. I'm going to describe lifestyle interventions for people living with Parkinson's disease. And then we're going to try to understand how those interventions can improve both motor and non-motor symptoms of the disease, and in the case of exercise, can slow down progression. So a little bit of background. So Parkinson's disease, we know, is the second most common neurodegenerative disease after Alzheimer's. It's estimated to affect 1 to 2% of the population over 65, and it has a slight predilection for affecting men more often than women. The average age of onset of 6 is 60. We obviously know some very famous faces of people with early onset Parkinson's disease, like Michael J. Fox. And it can affect children as well. We call that juvenile Parkinson's disease, which is fortunately very rare. So what causes Parkinson's disease? When we talk about approaching treatment, understanding the pathophysiology or the cause of the disease is really critical. So we know that purely genetic, biological or environmental forms of Parkinson's disease are extremely rare. And most cases of Parkinson's are caused by a combination of some genetic or biological predisposition and environmental exposures. So Parkinson's disease is really a heterogeneous disease. No two people with Parkinson's probably have the same cause of their Parkinson's disease, and nor do they manifest the symptoms of the disease in the same way. And so in approaching the diagnosis and treatment, we really have to take that individuality into consideration. Parkinson's disease is a clinical diagnosis. What this means is that we in the field use our clinical expertise to review your history, look at your movements on your examination to come to the diagnosis. There is no blood test or brain scan that can definitively diagnose Parkinson's disease. So those core features, though, that allow us to make the diagnosis are the motor features of the disease. So the slowness of movement, what we call bradykinesia, the stiffness in the muscle tone, what we call rigidity, tremor, which is not present in about 20% of people with Parkinson's, and then at least 2 of these other supportive criteria. We know, however, there are many other associated symptoms beyond these core symptoms on which we base our diagnosis. These include several other motor features of the disease, hypophonia, that change in the voice, hypomimia, which is the word we use to describe the flattened facial expressions, dysphagia, trouble swallowing that can happen as the muscles in the throat become impacted by Parkinson's, micrographia, a fancy word for that change in handwriting, which can become small and cramped. We know that there are postural changes in Parkinson's disease, stooping forward most commonly. We also know that Parkinson's changes the way you walk. So festination is a word that we use to describe those small shuffled steps that happen particularly when you're first starting to walk. And at the more extreme end of the spectrum is something we call freezing of gait, where the feet feel as if they're glued to the floor, and no matter how much you're telling them to move, they just don't want to take a step forward. But I want to also bring your attention to the fact that Parkinson's disease is much more than the motor symptoms of the disease and is really a multi-system disease that affects many aspects of our body and its functions. So these can include what we term the non-motor symptoms of Parkinson's. Anosmia, which is a decrease in the sense of smell. Changes in sleep. I would say almost every person I've met with Parkinson's describes that their sleep has been impacted in one way or another. Very characteristic of Parkinson's disease and sometimes predating the onset of the motor symptoms by decades is something we call REM sleep behavior disorder, where people can act out their dreams in sleep. But people also experience fragmented sleep, differences in their sleep-wake cycle, daytime fatigue. Even if you're sleeping really great, people often describe just feeling excessively fatigued during the day. Parkinson's can also affect the part of your nervous system that controls your sympathetic and parasympathetic responses, what we call the autonomic system. This can manifest with symptoms like orthostatic hypotension, which is that lightheadedness when you first stand up. Bladder dysfunction, so having to pee, really urgently, really frequently. Constipation, extremely common. Erectile dysfunction, sialorrhea, which is drooling, changes in sweating. We also know that Parkinson's can affect your mood and thinking. So not only is receiving a diagnosis like Parkinson's disease sometimes associated with a significant anxiety or depression just around receiving that news, but the disease itself can also change the biochemical balances in your brain and make you more prone to suffering from symptoms of depression or anxiety. Another symptom that patients often have a hard time articulating is something that we call apathy, which is a difficulty getting motivated, sort of losing interest or losing enjoyment in things that you used to enjoy. Cognitively, patients often describe a slowness of their thought process, what we call bradykhrenia. They can also have that tip of the tongue sort of phenomenon, like where you're like, I know that word, it's on the tip of my tongue, right? And really much more in advanced Parkinson's disease, people can experience dementia. Sensory and pain symptoms are also very common in Parkinson's, and I don't think that these are often focused on very much because we're so focused on treating the motor symptoms. But people can have pain, for example, bicep tendinitis or shoulder problems from underlying stiffness and slowness in their movement. They can also experience numbness and tingling in their fingers or toes as part of Parkinson's. So the pain symptoms can be quite variable and multifactorial in nature. So the average patient with Parkinson's experiences 7 to almost 12 of these non-motor symptoms of the disease. And as the disease progresses, the prevalence and severity of these symptoms increases. We know that these symptoms are associated with increased morbidity and nursing home placement, and it involves more than just dopamine, right? More is going on in the brain and in the peripheral nervous system than just that loss of dopamine that's responsible for those motor symptoms. We know that there are certain risk factors for these different non-motor symptoms. Some gender influences, where some of these non-motor symptoms are more common in men compared to women with Parkinson's. Older age, certain motor subtypes of the disease, what we call the postural instability and gait difficulty subtype, the PIGD subtype of the disease tends to have more of these non-motor symptoms. And we also know that there's an association between these non-motor symptoms and a higher total dose of levodopa. This probably goes along with the fact that we have more of these non-motor symptoms as the disease progresses, and you need more levodopa as well. This is what's often referred to in the Parkinson's world as sort of the tip of the iceberg phenomenon. People see that you might have a tremor, that you might be walking slowly, but they don't see beneath the surface to all of these other non-motor symptoms that you might be struggling with. And the reason I want to highlight these today is because there are many lifestyle interventions that you can do that can really help improve the treatment of these non-motor symptoms, because the bottom line is we don't have great medications to treat all of these symptoms, and they contribute significantly to quality of life in Parkinson's disease. We do have formal ways of measuring and trying to quantify these symptoms. One is called the MDS-UPDRS. That's the Unified Parkinson's Disease Rating Scale, has a section reviewing these symptoms. More recently, there was also a push to develop a specific non-motor symptom questionnaire for Parkinson's disease. And it has these 9 domains listed here. And I just highlight this because you might not find yourself really bringing up or addressing these symptoms in your appointments with your physicians. You know, they want to talk about titrating your levodopa, maybe adding some different medicines to target your tremors or your stiffness. But sometimes if you don't bring up some of these other symptoms, they won't necessarily ask. And so there are ways of sort of formally reviewing and documenting these symptoms that we have. I really love this slide, which is from a review a few years ago looking at Parkinson's disease progression. And again, highlighting sort of under the y-axis there, under this midline, all of the non-motor symptoms progressing over time in conjunction with the motor symptoms. And one of my colleagues who's a leader in this field, Dr. Ray Chowdhury, sort of describes this as the Parkinson's journey, as you're passing through different phases of Parkinson's disease and contending with different challenges. So how do we approach treatment of Parkinson's disease? Well, I would argue that it's really an individualized approach. We have pharmacologic treatments, of course. We have surgical treatments for Parkinson's. We have sort of individual considerations, you know, what other medical conditions you might have that we need to take into account. I put in parentheses there disease-modifying therapies because the field is very active in researching these, but we don't yet have something we can prescribe to you to slow down progression of disease. And then we have the non-pharmacologic treatments, and we're going to focus on those today. So these really include those lifestyle interventions. I also want to emphasize here that when it comes to medications, the decision to start medications really depends on your individual symptoms and how they're impacting your quality of life. We don't yet have a disease-modifying treatment, and we really need to individualize those treatment choices. And the same holds true when we're talking about non-pharmacologic treatments. So we have medications, more medications. Sometimes it feels like a lot of medications. I think that's one thing we hear often from patients with Parkinson's is that, you know, I'm taking a handful of medicines every day. And Dr. Tagliotti will talk to you about newer medications being developed. But it's true that in order to effectively manage symptoms, we have multiple medicines, often taken multiple times per day. We have some newer on-demand therapies, rescue treatments for motor symptoms. We have surgical treatments, and we have some newer approaches to levodopa administration on the horizon, like levodopa pumps. So up next, Dr. Tagliotti is going to explore all of these exciting new pharmacologic treatments with you. And we're going to spend the rest of this hour talking about individualized lifestyle interventions for Parkinson's disease. So let's back up a bit. What does it mean to be healthy? Well, I love this definition from the World Health Organization, where they state that health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmary. And so what is wellness? When we're talking about living well and being well, wellness, then, is the active pursuit of activities, choices, and lifestyles that lead to a state of health, physical, mental, social well-being. This means that wellness is really a proactive and conscious decision that each of us can make. It's multidimensional and holistic, and it can encompass many facets of your well-being. So physical well-being, mental, spiritual, emotional, social, and even extending to the environment that we live in. So there's been a push, I think, within medicine as a whole to sort of shift the paradigm from sort of a traditional medical paradigm where you get sick, you go to your doctor, they try to fix that. You know, what's the matter with you and how can I fix that? To more of a holistic and proactive approach to wellness where we ask not what's the matter with you, but what matters to you? How can we support your holistic well-being, incorporating not only the, prescription pharmacologic Western medicine approaches at our disposal, but also these other non-pharmacologic treatments. So thinking about what gives you purpose, what brings you joy, these are things that can help shape your approach to make those self-directed decisions about promoting your own well-being. The Global Wellness Institute also makes a distinction here between the term wellness and well-being and happiness, the latter being really your perception of your state of well-being, whereas wellness relates to sort of these actions and activities that you do to support that. So we're going to go through and review the evidence available from the medical literature on exercise, nutrition, sleep, mind-body approaches, and social connection as aspects of a healthy lifestyle for Parkinson's disease. So we're going to start with probably the most well-studied and the most well-supported, which is exercise. And I think many people in our field would tell you that movement is medicine for Parkinson's disease. We have very good data at this point in animal studies of Parkinson's disease that exercise is neuroprotective, meaning it's our only disease-modifying treatment that's been shown to slow down the progression of the disease in your brain. It can improve your motor symptoms, your flexibility, your core strength, your walking, your balance, but it also can improve those non-motor symptoms. People who exercise regularly have better sleep. It can lift your mood. People who exercise regularly have a decreased risk of experiencing cognitive decline with Parkinson's disease. So for all of these reasons, exercise is probably one of the first treatments that we recommend for Parkinson's, even before we start talking about a medication. Now, people often ask, well, what should I be doing? What specific exercise plan should I do? And there isn't really one best exercise for Parkinson's. In fact, almost every specific exercise intervention that's been studied has been shown to be beneficial. So it's more about then tailoring your exercise program to your interests, your capabilities, and perhaps combining your exercise with some of these other things like social connection. So this is from a great review article talking about the treatment used at different phases of Parkinson's, and in the red box there is exercise, which is the only treatment here that's really spanning the entire disease continuum. So even if you were just diagnosed or if you've had Parkinson's for 20 years, it's never too late to incorporate exercise as part of your treatment plan for Parkinson's. So let's talk about the science of exercise. Why does it work? What do we think is happening in the brain? So we think that exercise is promoting what we call neuroplasticity. So exercise can sort of strengthen connections between different parts of the brain. It can form new connections to try to sort of compensate or circumvent connections that have been lost. It also can promote the release of growth factors in the brain to help protect those cells that are experiencing damage from the stress of Parkinson's disease. All of this can impact the way your brain is connected and functions, so that ultimately translates to improvement in your behavior, your movement, your sleep, your mood, your thinking. We know that epidemiologic studies show that people who exercise regularly in early and midlife have a lower risk of getting Parkinson's in the long run. And those with established Parkinson's disease who exercise regularly have slower disease progression over time. As I mentioned earlier, exercise has also been shown to reduce the risk of cognitive decline in Parkinson's disease. And those specific animal studies, so when we're able to look under the microscope, we can see that exercise protects against dopamine cell loss. It can alter those synapses, those connections between the cells in the brain. It can modulate neuroinflammation. So inflammation thought to be part of the cascade of events that happens that causes damage to the brain cells in Parkinson's disease. And finally, it can stimulate the release of growth factors, one specifically called BDNF, that's been shown to be neuroprotective. So hopefully I've convinced you that exercise really does change your brain. And so now it's time to think about designing your exercise program. So the recommended intensity of exercise is that you should exercise for at least 30 minutes, up to 60 minutes each time you exercise, and hopefully at least 2 to 3 times a week. But really, probably the more the better. If you could do 30 minutes of exercise every day, I think that would be amazing. There's a role for relying on your social connections through groups like the Parkinson's Association of Santa Barbara, where you can have a class or an exercise buddy even. This makes you accountable to your exercise regimen and also taps in to the benefits of being socially connected, which we'll talk a little bit about later. It's also been demonstrated that sort of changing your routine a bit, sort of challenging your brain, is also adding further benefit to your exercise. So don't get bored with your exercise routine. Do something fun. Do something that's going to challenge yourself. Get outdoors. I think we're fortunate to live in a beautiful place of the world where usually it's not so rainy all the time and we can get outside. And I think as we'll talk a little bit later about some mind-body approaches and their benefits, but I think sort of being in nature, being outside, has its own sort of spiritual benefits as well. And so if you can exercise while also getting some sunshine, that's probably killing two birds with one stone. The components of your exercise routine. So to really get those neuroplastic benefits from exercise, we want to incorporate some aerobic exercise, walking, biking, swimming, boxing, as well as some skill-based exercise. And then some exercise probably focused on balance and fall prevention. So when we talk about skill-based training, we're talking about a goal-directed practice to sort of acquire a specific skill. This allows us to sort of challenge beyond what we're currently capable of. It motivates us. I think many of us are, sort of naturally competitive. We want to get better at something. And it also facilitates that awareness of your own movement through feedback. It can also be progressive, where you might start a skill at one level and progress up to something more challenging over time. So examples of skill-based movement and exercise that have been studied in Parkinson's disease include Tai Chi, tango dancing, believe it or not, boxing, what's been called amplitude training, what sometimes is referred to as big and loud therapy for Parkinson's, treadmill training, cycling. The list really goes on and on. So all of these are considered skill-based exercise activities that really challenge not only your movement, but also your brain. So it's something you really have to sort of think about and coordinate a complex and skill-based movement. So as you're all now reflecting on your current exercise routine, you can ask yourself, am I acquiring a skill? Is it challenging? Do I feel like I'm working hard? Is somebody giving me feedback on my performance? Am I aware of my movement? And do I feel like I'm just doing the same thing again and again, or am I making some progress? Is it fun? Is this something that I look forward to doing that could become a lifelong habit, or does it feel like homework that I dread, when it's time for my exercise? Am I changing environments? Getting outside, going to the gym, going, in different environments. We all know when you're at the doctor's office, your walking looks the best it's ever looked. You go down our nice smooth hallway, there's no distraction, no real world environment around you, and, my patients say, well, usually it doesn't look this good. And I'm like, I realize that, this is a very artificial environment. So getting out in your real environment and practicing your movement is very different than being in the physical therapist or the doctor's office. And am I motivated? Can I do this on my own, or do I need a physical therapist, a trainer, somebody else guiding me in my exercise program? And that brings me to our colleagues under the physical medicine and rehab umbrella, the physical, occupational, and speech therapists who make up part of the treatment team. So we know that these individuals really provide our best therapies for speech impairment, gait and balance changes, and freezing of gait in particular. They can also be really helpful in jump-starting your own home exercise program. So if you're just like, I've never been someone who exercises regularly, I just don't even know where to start, meeting with a physical therapist can help tailor an exercise program to your needs, your capabilities, and then hopefully tap into something that you can then continue long-term on your own. So next, we'll talk about nutrition in Parkinson's disease. And this data really comes not just from the Parkinson's literature, but also from research in other neurodegenerative diseases like Alzheimer's disease. So the Mediterranean diet has been demonstrated to be probably the most beneficial for brain health. This practically includes eating a lot of fresh fruits and veggies, olive oil, fish and lean protein, whole grains, nuts, seeds, legumes. Really looking for variety and color on your plate is the goal. You don't want to avoid fat entirely, but you want to focus on healthy fats. You want to use spices and herbs, some of which have some antioxidant properties that may be beneficial. And lastly, what this diet specifically does not include is a lot of red meat and dairy. So this diet is thought to be beneficial because it's very rich in antioxidants. So what we call phytochemicals, the things that give our fruits and veggies lots of color, right? Curcumin, resveratrol, flavonoids, berries and cruciferous vegetables have a lot of these. And certain spices like cinnamon, turmeric, ginger, also rich in antioxidants. Some people even choose to take this as a supplement, like a turmeric supplement, rather than incorporating it into their diet. And then we have healthy fats and omega-3 fatty acids that we can also get from things like fish, nuts, seeds. Flax seeds and chia seeds can also be helpful for constipation. So you can see how the diet might play multiple roles in Parkinson's. So a quick note about levodopa. So levodopa, our gold standard medication for Parkinson's disease, is itself an amino acid. This is the building block of proteins. And so it does compete in your gut for absorption with other proteins, other amino acids. So your physician may advise you to take this medication away from food. And what they're really meaning specifically is away from a large protein load. So that way it can get fully and well absorbed when you take it. Constipation, I mentioned earlier, is a very common non-motor symptom in Parkinson's disease. And modifying your diet can help you to manage this symptom. So eating a lot of fiber, whole grains, fresh fruits, leafy greens, seeds I mentioned, like chia, staying well hydrated. None of us drink enough water. And exercise actually can also help improve your gut motility. So, you know, if you're not moving, your gut's not moving either. And so exercise can also help keep those bowels moving. I mentioned earlier another non-motor symptom called orthostatic hypotension, which is that lightheadedness upon standing up. This can be part of Parkinson's disease, impacting your autonomic nervous system, but can also be exacerbated as a side effect of some medications. And it does, we care about this a lot, right? Because you can faint, and even if you don't faint, when your blood pressure drops, that feeling of lightheadedness can make you unsteady and contribute to an increased risk of falls. So, you know, when we approach this symptom, we of course want to eliminate any medications that might be exacerbating it if possible. We also might start with some conservative therapies like compression stockings, abdominal compression, increasing the amount of salt in your diet. Some patients even use salt tablets to supplement or drink something like V8, right, which is very salty sort of liquid. Eating more frequent, smaller meals can also help modulate this symptom, because after a large, heavy meal, where does all your blood flow go? Right to your gut to digest it. That means it's not going to go to your brain, and when you stand up after that big, heavy meal, you're going to be more prone to feeling lightheaded. Elevating the head of bed when you're sleeping at night can also help prevent the normal nocturnal diuresis that takes place, so that when you wake up, your blood volume is not so depleted and you have more gas in the tank, if you will, so you don't feel so lightheaded. But really, I felt like this deserved a slide of its own, because I would say the bottom line helps with many symptoms is drink more water. People also ask about caffeine and alcohol in Parkinson's disease. And we actually have pretty good evidence from epidemiologic studies that people who drink a moderate amount of caffeine regularly have a decreased risk of getting Parkinson's disease. And one of our newer medications on the market, called istradefylline, was actually developed out of the observation that caffeine can help with some motor symptoms of Parkinson's disease. So caffeine acts on a receptor in the brain called the adenosine receptor, and so this drug was developed to act specifically on that receptor to help benefit some of the symptoms. Now we're going to switch to talking about sleep on the next slide. So obviously there's a balance there between how much caffeine you're drinking and your ability to sleep well at night. So don't drink caffeine late in the day, don't drink excessive amounts of caffeine. The same goes with alcohol. So we know that alcohol in excess is bad for our brains, can damage our peripheral nerves, damage our brains, further impacting our balance. So not a great choice. But we also know that moderate alcohol intake is associated with a reduced risk of Parkinson's disease. So people who don't drink at all actually have a bit higher risk of Parkinson's disease. So there probably is some benefit of a moderate amount of alcohol. But I say this with caution because if your balance is going to be impaired after a glass of wine, then that's, of course, a greater risk than any theoretical benefit of antioxidant in that glass of wine. So let's talk next about sleep. So sleep has a very important biological function. You know, we spend a lot of our lives sleeping. It's something we don't think a lot about. For most of us, we just do it until we don't, right? Like until you have insomnia or trouble sleeping, you realize how much you took for granted the fact that you slept so well when you were younger. I know I took for granted how well I slept before kids. I've never slept the same since having kids. Right, so your doctor may say, well, you need to practice good sleep hygiene. And so I think it's important to spell out what that means when we say that. So probably one of the most important parts, but also one of the hardest parts, particularly if you're retired, is to have a sleep schedule. You might not have to get up for work at a particular time, but it actually is beneficial for your own body's circadian rhythms to have a set time you go to sleep and a set time you wake up every day, even the weekends. You also want to have a healthy sleeping environment. So a dark, relatively cool temperature. Do you have a good mattress? Is it very dry? Do you need a humidifier in the room? So making sure that your environment is set up for success. And then what we are all guilty of, myself included, is avoiding screen time for at least an hour before you want to fall asleep. So that blue light that our cell phones, our tablets, our laptops, our TVs are emitting at us actually stimulates your brain to thinking that it's daytime and really impacts the release of hormones that tell your body that it's time to fall asleep. And so trying to put that cell phone down, put your tablet, your iPad, your laptop, turn off the TV, is probably one of the hardest habits for people to break. I know many people say, well, I like to fall asleep with the TV on. It sort of, bores me to sleep. But that's really a bad habit. I mentioned earlier diet and alcohol, but avoiding excessive alcohol or caffeine, of course, is important for sleeping well. Also, just avoiding eating or drinking too close to bedtime in general, because that can also disrupt your sleep. Urinary frequency and urgency is something that also disrupts sleep a lot. And so trying to concentrate that drinking more water earlier in the earlier half of your day rather than in the latter half of your day to minimize the impact of getting up to urinate in the middle of the night. Establish a bedtime ritual. What does this mean? This is sort of having a wind down routine. It's something that, you're going to turn off the TV, put away your cell phone, and then you're going to have a routine that's going to help your body sort of get in a state that's ready for sleep. This might be reading a book, listening to some calm and quiet music, maybe drinking a soothing tea, listening to a guided meditation, whatever it is for you, sort of developing that routine that's sort of getting you in the mood for sleep, winding down from your day. In the morning, getting some morning sun can help sort of reset those circadian rhythms. So this is where, again, that exercise and outdoors can all combine to some benefit. And of course, avoiding long daytime naps, right? So if you're sleeping for 3 hours in the middle of the day, you're just not going to be tired enough to get a full 8 hours of sleep at night. And exercise. I skipped over exercise, but yes, exercise also helps you sleep better at night. I'm going to spend just one slide here talking about mind-body approaches. So this is something that I think is really hard to study, right? I can't tell you, like, we have evidence that if you do XYZ things that it's going to impact you positively, but I think a lot of it is common sense. And the bottom line is that I think all of us know if we're stressed, if we're anxious, if we're upset, that state of mind impacts how we physically feel. For people who have tremors, you know very visibly that when you get anxious, stressed, or even excited, you know, watching March Madness or, you know, a suspenseful movie, like that tremor is going to get going. There is no doubt that our state of mind can impact our physical symptoms. And so finding ways to tap into that to your benefit is really what these mind-body approaches are about. So is this yoga? Is this Tai Chi, meditation, mindfulness practice, self-compassion or gratitude journaling, right? Like writing down every evening as part of that wind-down routine, like the top 3 things that you're grateful for today. I started doing this recently with my first grader, and I think it's, you know, I can see how it's benefited her in sort of her attitude and resilience. Breathing exercises. So when we take a deep breath, you know, people say, you know, oh, just, you know, take a deep breath and relax. It actually changes our physiology when we take a deep breath. It sends those signals to our parasympathetic nervous system to slow down our heart rate, to calm that surge of adrenaline that might be happening. Maybe it's playing music or listening to music. Maybe it's art or observing and appreciating art. Connecting with nature, what is sometimes termed forest bathing, right? Getting out in nature and really being mindful about your surroundings, sort of as a way to sort of help you regulate your autonomic nervous system, reduce stress, sort of tap into that mind-body connection to your benefit. So I mentioned earlier that when I originally was invited to talk about living well with Parkinson's disease, it was 2020. And I think there's no doubt that the COVID pandemic has greatly impacted patients and their loved ones with Parkinson's disease. So COVID, of course, had a direct impact on many people. People got COVID. It also had a very indirect impact. It cut us off from our social connection. We couldn't go to our exercise class. We couldn't see our friends. You know, we maybe were even afraid to leave the house. That had really, I think, a negative effect on our whole society, but especially on our patients living with Parkinson's. So we saw that people became more socially isolated. There was a lot of, I think, stress and anxiety about, am I going to get COVID? What's going to happen? And really more, you know, that all of that led to more physical immobility too. You couldn't get out and exercise. You couldn't move as much. And this diagram here really showed that downward spiral that happened for a lot of people during the pandemic. But what we also found was that cognitive flexibility, that ability to adapt and to be resilient and creative in the face of this challenge was a positive thing that came out of the pandemic, and I think really highlighted for all of us in the field the importance of these other things we're talking about. So, you know, people turn to like Zoom workouts, Zoom-based support groups, you know, mindfulness practices. You know, thank goodness for FaceTime that we could call and see our loved ones. Even before the pandemic, though, there was well documented in the literature the negative impact of social isolation and loneliness on people with Parkinson's. And this, you know, was just really exacerbated by the pandemic. And so the last sort of wellness tip that I'm going to give you today is about social connection. And I think all of you are here and hopefully will reap the benefits of the social connections you're making today. But, we saw that people couldn't access their care. I, even as a physician, had to go to telemedicine visits. And I know it's not the same. I would feel depleted at the end of a day just staring at a screen on telemedicine. It's not the same as that in-person connection, which is really revitalizing and reinvigorating. It impacted mental health. Caregivers, we gave a shout out to all the caregivers in the room earlier, really took on a heavy burden during the pandemic. Ultimately, there's been a move now, I think, out of what we've learned through the pandemic to do something that we call social prescribing. We talk to you about diet, exercise, sleep, we prescribe you medications, but could we and should we prescribe socialization, right? And this is where having resources, having physicians in your community who know what those resources are, to say like, hey, have you heard about this support group or this exercise class? You really love knitting, like maybe there's a knitting club you can get involved in. There's so many things. And so I think you'll see a movement hopefully toward more awareness of this. Just recently, under I would say the vision and leadership of my colleague, Dr. Subramanian, in collaboration with a psychologist, Dr. McDaniels, we've put out a couple papers just this year about wellness in Parkinson's disease. And you can see a lot of this is really about that psychological adaptation that has to happen over the course of the disease. So how do we take that feeling of loneliness, stigma, that uncertainty that comes with living with a diagnosis like Parkinson's disease, and promote positive psychological adaptation, resilience, psychological flexibility, giving you back some self-efficacy, some sense of control. All of those things, those sort of shifts in how you see the world, how you see your disease, are really critical. And these two papers were sort of like a duo, one more focused on early diagnosis and one with mid and late stage Parkinson's disease. But the bottom line is that these psychosocial adaptation strategies can improve quality of life in Parkinson's disease, and really sort of give you some control, some proactive steps that you can take to try to promote this. And this is where seeing a psychologist, a counselor, a therapist might also be helpful. So maybe through your support group, you guys, we'll talk about a lot of these strategies without realizing that this is what you're even talking about. But there are also professionals in the medical field who can help with some of these strategies, sort of shifting that frame of mind and really, trying to be more proactive, more positive. So, in summary, I think we're really, as a medical community, shifting toward a paradigm of more holistic care for Parkinson's disease. So I spend part of my time at the West Los Angeles VA, where we have a Parkinson's Center of Excellence. And within the VA, they've developed something called Whole Health. And this is really looking at you in the center and everything that surrounds you, extending to your community. We have other models of holistic care in Parkinson's disease that have been developed as well. The Parkinson's Vitals is one trend that's being promoted recently, where we're not just looking at your motor symptoms, but also that non-motor symptom burden and other things that we know impact our patients as they age, like bone health, right? So osteoporosis, a huge risk for a negative outcome if you fall. And then also being cognizant of how Parkinson's might interact with other comorbid diseases, diabetes, for example, certain medications that we think may worsen outcomes in Parkinson's, like anticholinergics, and being really mindful of sort of this whole picture. Your vision, your hearing, your dental health, things that we typically don't think of as part of Parkinson's disease, but we know that as you age, your vision may decline, your hearing may decline, and we know that people who have significant declines in those senses actually have an increased risk of cognitive decline, right? So if you're not hearing well and that's causing you to withdraw from social interaction, that's going to have a negative impact down the road. So we really need to be more holistic in the way we're looking at sort of your well-being with Parkinson's. And so in doing this, the multidisciplinary team has really expanded. And so I mentioned our physical, occupational, and speech therapists earlier. I mentioned psychologists, therapists, counselors, but this maybe also includes a gastroenterologist if your constipation is a real problem. This might also include a psychiatrist if you're struggling with mood symptoms. This might also include your OBGYN if you're considering hormone replacement therapy. How is that going to impact and interact with all of this, right? So the multidisciplinary care team is really expanding to allow us to provide a more holistic approach to treating Parkinson's and really individualizing that care. So one of my mentors told me, the one thing that's true about Parkinson's is that no two people are alike, right? So each one of you is a snowflake. No two of you are alike, and so should your treatment plan not be the same as your buddy down the road. Medication management is just one piece of the treatment plan, and hopefully I've convinced you that there's a lot of other parts of the treatment plan that you can engage with. And we want to address wellness as a whole and consider all of the symptoms that PD can cause, not just the motor symptoms, but also the non-motor symptoms. And so I think, I'll leave it at that as we move to more personalized medicine, more individualized care for Parkinson's, it's important to work with your care team to find what's best for you in balancing the pharmacologic and the non-pharmacologic approaches to managing Parkinson's disease. So thank you very much.